I'm Dr. Sambi Abraham, Director, Abraham's Fertility and Gynec Center. This is the uterus, this is the cervix, this is the uterus, this is the tube and ovary. What can come is that there can be an infection of the uterus. Now, cervix is destined to protect the uterus from infection. Suppose an infection take place by chlamydia or gonorrhea. This infection can spread to other parts. Can be caused by bacteria also. So, that can cause irregular bleeding, that can cause fever, chills. They can have constant pain. So, this is common in sexually active women, but we cannot say that all cases of all patients developing pelvic inflammatory disease are due to hypersexuality. No, it is not like that. Some people may have low resistance to infection. So never be under the misconception that if somebody is developing pelvic inflammatory disease, it is because they are sexually hyperactive. Need not be. Their resistance there may be low. That can be also a problem. But this is more common in sexually hyperactive women. So we have to be more careful. So bacteria, chlamydia, gonorrhea, all these infections can cause this problem. So these infections can spread along the cervix, the uterus, tubes and ovary and cause problems. It can cause irregular bleeding, pain abdomen, frequency of urination, difficulty in passing urine, all sorts of problems, and it can add to your agony. So what I mean to say is that we have to be very careful in our sexual relations. We have to clean that area, very careful about the partners. If they contract an infection, that can spread to you. So once an infection sets in, it is not a simple thing. This infection of the uterus lining is called endometritis. This infection of the tube is called salpingitis. This infection of the ovary is called oophorytis. So once an infection sets in, now suppose I have got fever, now I will not be comfortable, I will have headache, I will have indigestion, I will be very weak because all my systems gets affected. Like that, it can affect the function of tube, ovary and cause problems. So it can cause infertility, it can cause abortions, it can cause pain abdomen, regular bleeding. So once you have these symptoms, you have to be careful, you have to consult the doctor and rule out any cause of pelvic inflammatory diseases. So this has to be in our mind. So once a person develops this infection, they can have this infection spread to other parts, or they can contract an infection later also. So if you develop irregular bleeding, you develop pain abdomen, frequency of urination, chills, if you feel always uncomfortable in your lower abdomen, please rule out a pelvic inflammatory disease. I never want to spread the message that it is only seen in hypersexual women. It can be due to low immunity of the system also, but it can be due to hypersexuality also.